so we're driving to take me to the surgical center. We just dropped my daughter off at preschool, and I don't have to be there till 10, and it's only 9, but we're just gonna kind of go there slowly and get there a little early. Feeling really tired, like I need coffee. Feeling hungry and thirsty. Can't have anything to eat or drink after midnight the night before, so feeling like I really want a big, huge bottle of water and some coffee. Got our hubby. He's gonna drive me and pick me up since I'm gonna be incapacitated. And little buddy, can't see him very good. There he is. Anyway, we have a minivan because we're awesome like that.
She has a minivan. I have a truck.
I have a minivan, you guys. It's my minivan. It's in my name. Anyway, so at the beginning I'll go into the doctor's, into the surgical center, and the nurse will kind of like do my vitals and check me over, and then the surgeon will come and talk to me, and we will just, like verify one more time exactly what we're doing, and then the anesthesiologist will come in and talk to me and ask me questions and make sure everything's good. Then they take me back, so it will be around 10:30 that they actually take me back. So
say hi, bub. How are you feeling?
Surgery in a few minutes, and feeling kind of scared. Why is it always so overwhelming to have surgery? I don't even know. Ow! Don't hit! Don't hit! No hitting. No hitting. No hitting. No hitting. Hey. So the surgeon just came in and we went over again exactly what we're going to do. He drew on my boobs and he talked about putting drains in almost for sure, and then also said he would save the implants and scar tissue. Well, he's going to take pictures of all the scar tissue for me, but he's going to actually save the implants that I can look at when I come back in to check up with him, I think tomorrow or the next day. So, interesting. Feeling a little nervous, but feeling okay. So, funny side note, I tried really hard to get this nose ring out because they told me I had to take every piece of jewelry out of my body. I tried so hard, you guys, and my nostril's too small to get my fingers up there. I couldn't pop it off. It was hurting so bad, and I was like, I can't do it. And they said you can just leave it in. So, thank you guys for letting me keep my nose ring in because it was brutal trying to get it out. Shed a few tears a little earlier, but hubby's gone now with the baby, and now it's just me, and I'm actually feeling really peaceful.
So I just picked up Amy, and she is in an immense amount more pain than any of the other surgeries she's had to go through. She does have drains, and I'm going to have to take care of those today for her until we take her to the doctor's tomorrow.
Just got picked up from the surgical center. In a lot of pain. Woke up in more pain this time than the other times. I think everything went well. They had me wrapped really tight. And I have 2 drains, so just heading home now to rest. Oh man, I was able to get up and walk into the bathroom. And see if we can turn this around here. Got some drains here and really tight bandages, and so I've got the 2 drains, and they'll be in for 2 or 3 days probably, or until they stop putting out stuff. So that's awesome. You can tell I'm pretty puffy. My core is pretty swollen. Kind of, just kind of retaining water from the surgery. But the pain meds kicked in and I'm feeling a lot better. So this is 1 day post-op. I'm bound really tight with a really tight bra. Also ACE bandages that go all the way around. I have 2 JP drains. So these drains that are draining the extra blood and serous fluid from where the implants were removed. That's going to help reduce the extra scar tissue that could form from extra fluid building up in there. Still a little bit puffy, but better than yesterday. Not retaining quite as much water today. My pain is a lot better than it was when I first came home yesterday. So I'm post-op day 1. Yesterday was surgery. It hasn't quite been 24 hours since I got out of surgery. When I first got out of surgery, I was in a lot of pain. Even before I left the recovery room, I asked the nurse to give me more pain meds because it was pretty excruciating. And the dose, I think it was Demerol that she gave me, didn't seem like it really even helped very much, but they assured me that once I got home and started taking the oral pain meds that I would be a lot better than having them give me IV meds. So they kind of pushed me out the door anyway. And when I got in the car, I was able to have a cracker and some pain meds, but of course those didn't kick in for quite a while, like probably a good hour. They didn't really start to take full effect. But so the car ride home was pretty brutal. I was in a lot of pain and I was crying a lot. I probably would have rated my pain at that point an 8 out of 10. Like if 10 had been like having my leg sawed off. So it was pretty intense. I was in a lot of pain. When I got home and kind of was able to get settled, and let my pain meds kick in, I started to feel quite a lot better, especially once I got some ice on me. So so I was able to sleep on and off yesterday evening and last night, probably waking up every 2 hours to just kind of get up and move around and get some water and maybe get new ice, and then taking my pain meds on time so that I haven't gotten into a bad pain slump. So overall, I feel like my pain is really well controlled today. I'm feeling pretty drugged up and groggy, but I feel functional, and I feel like the pain is really tolerable. So I'm bound really tight, as I showed you earlier. So that's kind of keeping everything really tight. I can already tell how much of a difference there is as far as how far my chest sticks out, and it's pretty amazing. That'll be interesting to adjust to, when you move past things and you have to move out of the way, well, I won't have to have so much room to move past something. But anyway, my little baby is sick. My little guy is really sick, so Kyle had to take Stella to preschool, and so his sister is here helping us with the baby since I literally can't lift him or cook for him or do anything for him. But I'm feeling a little bit better. I go and see the surgeon today at 2 o'clock where he'll I'm not sure exactly what he'll do. I'll kind of keep you guys updated on that, but I get to check in with the surgeon in just a few more hours.
Everything. How much drainage have you had in your drains?
Oh, it's in this river.
So let's kind of see what they do through today.
Yeah.
You'll probably have them in over the weekend. And then follow up with you Monday, just over the phone, tell what your drain's been doing, and we'll go from there.
Okay.
If it slows down to where you have less than 25 cc's per drain for 24 hours for a couple days, then we can get them out.
Okay.
So follow up Monday with me on those.
Okay.
Okay? Let's go ahead and take a look. And I'm just going to put your drains right here, right now.
Alright, I didn't even know how this bra worked.
Let's see if I can get it off. There we go. I'm going to unwrap you. And then we have, your tissue will tighten up. So I know things are just looking scary. They'll change significantly from this week to next week, okay? And we have some tape to remove.
They just don't like to come in when they're getting undressed. So, okay, I just want to make sure that you don't have any unusual swelling, that you don't. We're going to take the tape off here. And then Tasha will help you.
She's going to call Monday with her drain totals.
Okay. And we'll need to, when we do this, make sure that the tissue is sitting right
You'll
next
kind of
to
want to, when you put your bra on, pull your tissue up.
and that'll help tighten it better for you as well.
Is this bra even tight enough? Like,
It is.
it's
Yeah.
so-
It is,
Okay.
yeah.
This seems like it's so much bigger than I am.
No, and this will tighten up. And then hopefully next time we'll have the picture of the capsules, which are complete capsules out. And also
Sorry, that stare shirt came off with.
the implants too. We should have those for you too if
Okay.
you want.
Cool.
Okay, so you can, I can't shower of course until the drains come in.
Sponge maybe while those drains are in Amy, okay?
So, and take it easy. And
Okay.
then we'll see you next week.
Okay.
Okay.
Thank you.
Drink
Thank you.
plenty of
For sure.
fluids.
So come in on
Are you
Monday
still
for
filming?
sure.
Call
Yeah.
Monday.
Okay.
Yeah, she has a
just
YouTube
call
channel and
around.
she's doing.
We open at
So
9, so
good.
call around
Okay,
9,
good.
and we'll just go over what your drain holes are. If it's ready, we'll just sneak it in.
Any
If we
problems?
need another day or two.
Oh, we'll give
just
you a
do the
call.
same thing.
Thank you.
Yeah.
So I'm just gonna use these pads for a little more pressure here, so I'm just gonna pull up your tissue.
Okay. And I want to keep everything up high like that.
Yeah.
Just to encourage it to tighten up there, or okay.
And I'm just gonna go around and then I'll kind of pull your tissue up again.
Okay.
Is that okay as far as tightness goes? Yeah, if you do that, it's perfect. So when you're up at home, just kind of pull everything up. Okay, go ahead and let go. And let's have you wrap for this first week.
Okay.
And next week we can get rid of the ace round.
Okay.
And I'll get you some more pads so you can just change them out.
Kind of feels like it's pulling on the incision.
Okay, it's probably the drain.
Oh.
Okay, let me see if I can get this bra back on.
Yeah, here I can helpful with that.
Yeah, perfect. Okay, so go home, take it easy. Ice, lots of fluids,
Okay.
compression. Touch base with me Monday.
Okay.
And then just keep recording the drains. And you know how to strip drains and everything
Yeah.
from your profession. If you have any questions, call.
Thanks.
Okay. So we won't schedule an appointment, we'll kind of leave that up in the air
Okay.
based on what the drains do.
Okay.
And if you need to, if the drains are tugging or pulling and you need to kind of tape them off to the side or whatnot, you can,
Okay.
okay?
Just gonna move these down a little bit. Sorry. Oh, it's okay. The sweater just looks extra funny. All right.
Well, there's no judgment here. You're doing great.
Thank you.
Okay, any questions, concerns, call. The ice up top, ice the sides, and ice underneath, just not directly on the incision line.
Okay.
Okay?
Sounds good.
Any concerns, let me know.
Thank you.
You're welcome.
You can start filming. Hey guys, it's post-op day 2. So today's Friday, surgery was on Wednesday. Yesterday afternoon I went and saw the surgeon. Today I'm still having quite a lot of pain, quite a bit of swelling, especially like right up top in between my boobs, having quite a bit of swelling. Still have the drains, keeping the drains for till Monday, so like 3 more days. Oh yeah, still really tight, especially like around my ribs and where the incision is, where I'm wrapped really tight, and then have the bra, and then the drains are kind of coming out here too, so it feels really tight around my ribs, and it's kind of hard to take a big deep breath. It's painful to take a deep breath, but trying really hard to do it anyway. I'm getting up and walking around pretty often, trying to rest. It's hard when you have 2 kids at home and everyone's screaming for something all the time, even though my husband's here trying to help take care of everybody. My appetite's been super low, probably from the pain meds. I've been eating probably like two or 3 little meals, which is probably not enough, but at the same time I'm not really expending much energy, so I'm trying to keep my meals really high protein for healing, because protein's really super necessary for any sort of healing. Drinking plenty of fluids. Yeah, taking care of the drains is one of those things that's kind of actually takes more time and energy than a lot of other things. So with the drains, I have to actually like what's called stripping the tubing every like 3 or 4 hours to keep any clots from forming in the tubing, and if the clot formed in the tubing, then it wouldn't have any suction anymore. So doing that and emptying the drains 2 or 3 times a day. Yeah, so today I unwrapped everything just to kind of rewrap everything, just to kind of reposition and kind of give my skin a break for just a minute from the super tight of the ACE wrap and everything. And it's a pretty incredible how different I look. With everything bound, I'm like flat as a board. So hey you guys, I'm post-op day 4. It's Sunday. The surgery was on Wednesday. So my tummy has been having serious issues post-op. Being on pain meds, it makes it really hard to poop. So, yep, we're dealing with a little bit of distension here from not pooping as much as I need to. Still have the drains. The drains will be in for at least another day. Could be even till Tuesday. But, yeah, still have got 2 drains. And I think that actually right now that's what's causing me the most pain. It's hard to know for sure, but when I've unwrapped, the drain comes right along the bottom and into the middle almost of this left breast, and it's causing like an excruciating amount of pain. So I'm really hopeful that once I get the drains taken out, that my pain will improve significantly. A super tight sports bra, and then I have ACE bandages below, and I have to keep myself bound pretty much for 24 hours a day for the first week or so. I take it off periodically. Okay guys, I brushed my teeth and washed my face and put on some clean clothes. My butt is way too big for these pants. But I'm feeling, it feels nice to change clothes and to brush my teeth and stuff. It's always fun packing my drains underneath my clothes. Thank you guys for watching. I'll do another update 1 week post-op so you guys can see how I'm healing and how I'm doing and how my body's changing and adjusting, and also how I'm feeling. So thanks you guys, I'll keep you updated.